briefing, as you might know, is part of our Bloomberg Equality franchise. Normally, we're gathering folks all across the world, in New York, in London, and in Mumbai. But the state of the world being what it is, we wanted to bring you something virtual. But we hope intimate and we hope interactive. Today's briefing is sponsored by, and we're so grateful to them, LGBTQ Loyalty. We really appreciate their support on this. I also want to give you a few housekeeping notes before we get started. We're new to virtual events, just like you are, so bear with us. We may encounter some technical snafus along the way. My best advice to you, if your audio or video goes out, this is what I'm going to be doing as well. Just refresh your browser, just turn it on and off. Isn't that always the way that we solve our toughest technical problems? As I mentioned, this is an interactive event. We want to hear from you. On your screen on this platform that you're a part of, there is a Q&A box. If you have a question throughout, just type it into that Q&A box, click submit. Remember to include your first name and the city where you are so we can give you a shout out if we pick your question. We're also going to be doing some polling throughout this event. We want to make sure you're paying attention. So when you see that pop up on your screen, please participate. And if you feel like tweeting, please do so. The hashtag on Twitter is Bloomberg Equality. All right, let's jump right in. I'd like to bring on two leaders who definitely, as I pointed out, are on the front lines of fighting the coronavirus. We have the great benefit at our shop of working for a former mayor. We know the importance of mayors. So please help me welcome two just spectacular individuals, Mayor of Seattle, Jenny Durkan, and the Mayor of Chicago, Lori Lightfoot. Hello, mayors.
Hey, great to see you.
How are you?
Nice to see you as well. So before we kick off, I understand this is not that rare for you guys. You guys know each other. You're friends.
You know, mayors are tight. We have been on the front lines of a whole range of issues. And I got to say, though, Lori Lightfoot's got me beat on some of the keep you out of the park memes. And she's doing a terrific job in Chicago.
Well, we're going to talk a lot about that. And Mayor Lightfoot, let me start with you because I want to get a sense of you of what it's like in Chicago right now. Mayor Durkan mentioned those memes. I've seen them on Twitter as well. People are using your likeness to great effect. But give us a sense of what's happening right now in Chicago.
We have a lot of things going on, like
I think we're having a little bit of trouble with Mayor Lightfoot's audio here. Mayor Durkan, let me pivot back to you because we do have a situation here where you guys, for better and worse, were very much ahead of a lot of the rest of the country, certainly those of us here on the East Coast. What's the most important thing that you've learned that maybe we should be taking into account at this point?
I think two things. First is the virus sets the rules. It is voracious and it spreads so rapidly. And so we learned really quickly that by the time we saw and recognized that there were positive cases, we already had community spread and had to act with some of the great restrictions that we did. So the first thing is the virus sets the rules. And the second thing is you really have to come together as a community. The only way social distancing and these restrictions work is if the social contract works and people do what you ask them to do. And so far in Seattle, we've been super fortunate that people have done what we've asked, from employers having people telecommute to people do social distancing. And as a result, we've had one really positive effect, and that is we seem to have bent our curve and are on the way down. But the negative effect is it has been devastating on our local community. The people who had the less economic resilience were the ones to feel it first. And so we've been pushing really hard. How do we support those people? And I'll tie right into what our topic today is, because this virus has really shown a bright light on all the social inequities that were already existing in our society, in our city. And we know that those are the people who suffered the most. The social determinants of healthcare and health and well-being are being shown really quickly. And that's the things we have to focus on to change as we come out of this.
All right, so Mayor Lightfoot, I think we have you back with us. Sorry about that little technical glitch. I warned everybody that this could happen. So, Mayor Lightfoot, what lessons did you learn, from seeing what happened in places like Seattle, Los Angeles, San Francisco, but especially there in the Pacific Northwest, that you said, okay, I definitely want to do that, or maybe this is something I don't need to do as much as we fight this virus?
Well, we learned a lot from Jenny Durkan and from what was happening in King County, particularly around the dangers of congregate settings and what we needed to do to decompress nursing homes, jails, and things of that nature. Also looking at, and I think Mayor Durkan's 100% right, the strengths of your city shine through, but also the places where you are most vulnerable, particularly the stresses on vulnerable populations. You see those in bold relief. So it's been very helpful to see what's been happening in cities like Seattle, San Francisco, LA, and of course New York. And we're probably 2 weeks or so behind where they are in terms of the peak of the spike. But we have announced just yesterday some very good news. We started out in this pandemic seeing cases doubling every 2 to 3 days. We're now looking at every 12 days, which is a flattening of the curve to be sure. We're certainly not out of the woods, but we are seeing progress. And the only reason we're seeing progress is because we've done what Seattle has done, what San Francisco has done, is we've really urged and in some instances ordered people to stay home. We started talking about staying home if you were sick. Now it's you got to stay home. If you're not an essential worker, if you don't need to go out for food, for health care, you've got to stay home. And that's made a huge difference.
Yeah, absolutely. I want to pick up on something that you mentioned that certainly has gotten a lot of headlines, and that is the prison population. An incredibly vulnerable population there in the Cook County Jail. You've had just a really difficult thing to contend with. What are you doing about that now? And again, for the rest of us, what lessons can be learned? Because that seems to be one of the most difficult problems that we're facing across the country.
Yeah, Cook County Jail is actually outside of the city of Chicago's jurisdiction, but we have been providing technical assistance to the sheriff and the county really from day one around the jail. Congregate settings are hard. There's no question. And jails are set up for people to be in very close quarters. So it's the opposite of what you want in the context of a pandemic. So what we've urged is looking at ways in which you can isolate the people who are sick, put them in quarantine, make sure that you're doing testing of detainees as they're coming into the jail and certainly upon release. We've been very outspoken in making sure that people who are being released from the jail are coming into a very robust social safety net so that they can get services. If they're sick, that we can put them in locations where they can, if they don't require hospitalization, we've got hotels, we've got other alternative facilities that we're putting people in. But what we know is that there's got to be a tremendous amount of coordination among the various stakeholders. While we don't own responsibility for the jail, the residents that are in the jail are residents of the city of Chicago.
So I want to shift back, Mayor Durkan, to something you mentioned about the economic side of this, because it's interesting. I was talking to my wife in preparing for this. She's a small business owner herself and was pointing out how disproportionately this has hurt small businesses, certainly, who don't have the sort of lifelines that maybe a big company, a Starbucks or a Microsoft, to use some local examples for you, might have. And also the fact that many small businesses are both, run by and employ women. This is all about equality in many ways. What do we need to do for small businesses at this point? What can you do as a mayor in concert, obviously, with state and federal assistance?
So that is a really good point, and I think your wife is exactly right. We turned our dial in phases, and so within literally days of seeing the first positive case, we had the people that work for the city of Seattle telecommute as much as possible, but all of our large employers did that as well. And we saw a part of our city where those large employers were located. literally empty out with no workers coming. And those small businesses failed early. So we knew that as we turned this dial, that it was going to be small businesses and the workers, the minimum wage workers, the gig economy workers who were going to feel this first. So we tried to get a range of programs as quickly as we could to have some money to provide some resilience until federal funding could come in. We started with a small business relief package where we would get the small micro businesses, primarily owned by people of color and women, to give them $10,000 grants to get them through. We had so many more applications than we had funds available, but we got those out the door this week, and it has helped those businesses. We also wanted to make sure that we could get people some food security. So we converted our block grant money, which is a particular kind of money that cities and local government gets from the federal government. They have a lot of flexibility with. And we converted that into grocery vouchers, working with Safeway and other groceries so that we could get $800 into people's hands for the month. We just extended that program. We've had some people come forward and donate additional, so we'll be able to give it to those workers who've been laid off because of the pandemic. Again, the need far outstrips our ability to do this. Our goal was to try to build as much resilience and get some money into the hands of businesses and workers who felt it first so that they could make it through this really, really difficult time.
And so, Mayor Lightfoot, what are you hearing from state and federal leaders in terms of that aid? There's a lot of discussion going on in Washington, but at this point, I think it's fair to say it's more discussion than action, or at least recent action, when it comes to sort of replenishing those funds, especially for small businesses. How do you best advocate for a very diverse economy there in Chicago?
Well, I think we're doing some of the same things that Jenny is doing, but we are in constant contact with our senators. Senator Dick Durbin is the #2 on the Democratic side, working with Senator Tammy Duckworth, and then our entire congressional delegation, Republicans and Democrats. We are emphasizing to them that while we certainly appreciate the money that has flowed in the first CARES Act, it's primarily focused around reimbursing cities for expenditures related to COVID. It's not replacing our lost revenues, which is an issue that we really have to focus on the next go round. And Jenny's right. The small business monies just have not flowed in the way that we hoped. Part of that is because the banks that are distributing the loans are focused first and foremost on their existing customer base. We know in our city, and I know it's true in other large cities across the country, that we have a lot of people who are unbanked, maybe don't have a current relationship with a bank. Those are a lot of small businesses. We know that we have businesses that are owned by people who are undocumented. That's another niche. So we actually stood up a $100 million loan fund, and we started pushing those monies out this week as well and last week to really fill that void that's left by the Small Business Administration loans. But we've got to do more, not just for loans, but to grants, because businesses are being crushed. They are being hurt by the closures. Our hospitality industry, restaurants, bars, hotels, the service industries, whether it's a nail salon or a dog walking business, all those amenities that we rely upon on a day-to-day basis, these are the very businesses that I worry greatly about that aren't going to come back. And I'll also add, one of the other things that we're talking to our federal partners about is the concern about foreclosures. We are very much concerned that when we come out of this, the foreclosure rate is going to go through the roof. We know that people are struggling, already paying their mortgages, paying rent. We stood up a fund to help with that. But this is a B and T size problem, meaning trillion and billion dollars that are going to have to fix it. There's no city government, no state government that has that kind of discretionary funds. It's only the federal government that can come to the rescue.
I want to
Such an interesting point.
Yeah.
Please.
Can I add? I think Lori is exactly right on that. And I think what we have to remember is these businesses close not just by a natural economic development. They closed because it was a government's response to a threat to our nation. And all of these people have suffered these economic harms because of that. And that's why the nation has to step in to try to buffer this. It's the only way we were going to get out of it is we have that kind of scale of support in reopening and coming back and supporting people until we can do that. I also want to just point out another sector that we haven't talked about a little bit, because it's not just small businesses. The front lines of this were the small businesses and the small business workers, but they were our healthcare workers too. And we're now starting to see in the Seattle area that our hospitals have been under tremendous financial stress. They terminated all their elective surgeries and those kinds of things that actually paid the bills. And we have the looming possibility of furloughs in our hospital system. The very frontline workers who got us through this, who saved lives, the federal government needs to step up immediately and make sure that doesn't happen. We can't have a single healthcare worker out of work because everyone thinks we'll have some kind of resurgence of this virus, and we need our hospital and healthcare systems healthy, and that won't happen if we don't have our healthcare workers healthy.
You know, it's interesting to talk through sort of who's responsible for what. To some extent, both of you have touched on that. My sense is, and I would ask both of you to keep me honest, that both of you have pretty good relationships with your respective governors. You're part of the same party, which seems to help these days. We may face a situation in the not too distant future where you're getting one message from the federal government and another message from the state government. In that sort of situation, Mayor Lightfoot, what do you do? How do you sort of square what you may be hearing from Washington with what you're hearing from Governor Pritzker?
We're in that situation now, and we've really been in that situation from the very beginning. And it is challenging. There's no question about it. But you know, I think Jenny probably shares my view on this. Our residents demand immediate action and response. We don't have time to sort out the political tea leaves. We've got to respond. We've got to react. We've got to deliver immediately. So while it is not helpful to have a federal government that isn't stepping up and isn't acting and is even itself giving a lot of conflicting statements. And Jenny, I'll take you back to when we were on the calls the first weekend in February with Homeland Security, HHS, and the CDC, and we were getting this mishmash around flights that were being diverted from China to our airports. I've known, and I believe Mayor Durkan has known for a long time, that we had to make sure that we stood up and we got this ourselves for our residents. We still need help. There's no question. But we can't rely and wait and hope that the federal government cavalry is going to be just on the next hill and to save us. That's not been true at all through this pandemic. It's not going to be true going forward in the future. We certainly appreciate and will continue to advocate for more funds, but mayors have to do it for our own cities.
Yeah, I agree completely with that. The unfortunate thing is we can take the immediate actions, but the resources of the scale that we need can only come from the federal government. I've got a great working relationship with my governor, with our federal delegation. They've been doing terrific work. I talked to them this week. But imagine for a moment if any mayor said, I'm taking the next 2 weeks off in the middle of a pandemic. And yet that's where Congress is. They're adjourned when we have this immediate crisis in America. And so I think we've got to see the same level of collaboration and immediate response at the federal level, because every day in this fight is like a dog year. It makes a difference on so many lives that we need action, and we need it now.
Well, I want to dig into that a little bit more in just the couple minutes we have left. And Mayor Lightfoot, I'll start with you. Your predecessor in a different job, Rahm Emanuel, back when he was the chief of staff to Barack Obama, President Obama, I believe, famously said, never waste a crisis. And, you know, one of the issues, maybe thinking a little optimistically here, is this notion that in the midst of all of this, maybe there is a collective effort to solve some longstanding problems. They're in Chicago, you know far better than I. There have been so many issues around inequality, socioeconomic, racial, and otherwise. are there things that maybe you can do in this context, in this time of crisis, that maybe you couldn't do before, maybe solve some underlying structural problems?
Well, I think we have to. I mean, everything that we're doing, all of the outlays of resources, we are looking to build a foundation and infrastructure for the future. So, for example, we announced last week these incredible disparities that we're seeing in the rates in which Black folks are contracting the disease and also dying. And so we are looking at what do we need to do to address these disparities? How do we make sure that the work that we're doing now isn't just a temporary fix, but is building an infrastructure so we can not only highlight the disparities, bring people into connection with the healthcare system, address the underlying issues like diabetes, heart disease, respiratory illnesses, and the like, and make sure that we're doing that in a way that we can really change this going forward. Same thing around hunger in our city. We've spent a tremendous amount of resources making sure that we are feeding people, that we are doing everything we can to reach our young children, our seniors, our people who aren't connected, people who have SNAP resources but can't use them to buy online on groceries. All of those issues and all of that effort, we're making sure that we are learning the lessons so that we can build going forward and solve some of these seemingly intractable problems. So I really appreciate the question because it's very much in the mindset of what we're thinking about now.
Well, and similarly, Mayor Durkan, your challenge with homelessness has been well documented by Business Week and many others. I know it is a priority for you. What can you do now amid this crisis, but also what does it bring forth in terms of potential solutions or around something that really has become, no doubt, a crisis there in Seattle?
So I think that's a great question. And at the very outset of this, we knew that we had certain populations who were going to be most vulnerable to this virus. Our seniors in our long-term care and senior homes, people over 60 with underlying health conditions, but also our homeless population. So working with King County, who's been just a terrific partner through this, we stood up a system of things to try to deal with the immediate crisis. King County was able to stand up and finance a number of isolation and recovery facilities around the county, some of them in Seattle. We stood up a number of shelters so that we could de-intensify our shelters to actually achieve some kind of social distancing within the shelters themselves. We've also, for those who are unsheltered, tried to roll out a series of programs. We have a team called a navigation team that since the beginning of this crisis has been doing significant outreach to both educate people about coronavirus, to also give hygiene packs to them. We've stood up a number of hygiene facilities because as we close down businesses, we also close down restrooms. As we close down our park facilities, we close down restrooms and showers. And so we had to build back up some capacity for those people to have that ability to have somewhere to go to the bathroom or to wash their hands. But there's no question that long term, we have to do more there. We're really working hard to stop more people from falling into homelessness. So many people were living right at the edge, paycheck to paycheck. We stood up a program last week to provide rental assistance, to provide those families that had the least amount of resilience. And we saw we had to close it almost immediately because so many people applied. So we're trying to raise more money so people can at least meet their rent obligations for April. I stopped all evictions, but we don't want people to come out of this in debt. We need people we have to try to have people come out of this as stable as possible. And I agree with Lori, we will not have a choice about how we reorder society. If you look at history, when there's been these significant disruptive events and those that really take a broad cut against people in the economy, you have to try to rebuild everything about your democracy in your society to address that, because if you don't, they will. So we have to, the people will demand changes and we need to lead on that.
Well, we're going to leave it on that note, a little bit of a hopeful note. I hope for our audience, really appreciate the two of you spending some time with me and with us this morning. I know it is an amazingly busy time. And as you say, you are on the front lines and, really dealing with these problems head on. So Mayor Jenny Durkan from Seattle, Mayor Lori Lightfoot from Chicago, Thank you both so much. All right, we're going to continue on with our program. Thank you. We're going to continue on with our program. I'm going to bring in my partner, Carol Masser, joining me as we do just about every day remotely these days. Carol joining me from Jersey City. This is sort of our jam, Carol.
What a great conversation. I love
what there you are. Hi.
Here I am. I love what Mayor Durkan said, that every day is like a dog year. We say this, right? Like we go through the week and we're just amazed at how much news has come out about the virus, just trying to keep up with it. And then the impact, whether it's on markets, whether it's on the business world, whether it's on individuals, and kind of where we are in terms of the health crisis. So much to get our head around. But what a great conversation. And, I thought it was also interesting how they said, taking a vacation, a 2-week vacation, meaning Congress, going away. I can't imagine FDR doing that, during the Great Depression.
Well, it's an interesting point too. And listen, you and I talk about this all the time. I made sort of a joke about it at the top. We do have a certain appreciation for mayors, obviously. And,
Absolutely.
Our boss has certainly reminded us of that many times, but you and I have gotten a chance to interview lots of mayors over the years, internationally and nationally, regionally and otherwise. And I remember Mitch Landrieu, then the mayor of New Orleans, saying, when you're a mayor, you're walking by your problems every morning. They are not at all removed. People know who you are, and they are demanding action. I do love this program that our team has put together too, because we're really going from sort of the local to the state and national level.
Yeah.
So I'm really excited to hear a conversation coming up.
Well, and the thing is, we also talk about those folks that are on the front lines, whether it's mayors, whether it's governors. As you said, they're walking by their situation, their problems. They've become such an important voice, certainly in dealing with the virus. Speaking of important voices, I do want to bring in my guest. I'm delighted to have with us, certainly familiar to the Bloomberg audiences. And we're talking about the former Secretary of Health and Human Services. We're talking about Kathleen Sebelius. She was also governor of Kansas. She was also the insurance commissioner for that state. Secretary Sebelius, thank you so much for participating in this. One of the things that I find interesting is that, good morning, is that we all talked about that this virus didn't discriminate, and yet we have ultimately found out it does discriminate big time. And I found it kind of staggering and upsetting that this was top news, that this was impacting our most vulnerable societies and vulnerable populations. Why is it? We kind of know some of the reasons why it has, but why haven't we been better about protecting these populations?
Well, I think we see, unfortunately, the perfect storm of inequity as this virus cuts across the country and the world. People, unfortunately, lower income, too many men and women of color don't have access to health insurance, and they don't then have a regular doctor. They don't have regular preventive care. They are in a situation where they're often only dealing with the medical community at times of crisis. We have many more underlying pre-existing conditions in the minority population, higher rates of diabetes and heart disease, which again make for a vulnerable population when you have then an illness falling on top of them. We have folks who live in denser populated area, in denser households. The notion of social distancing and separating from others is great if you have a big yard to walk around in, if you have some place to get away from other people, if you're living in a public housing project, if you're living in a densely populated neighborhood and maybe multiple family generations in the same household. Again, it's a very difficult situation. All of the social determinants on healthcare, as you know, as the doctors like to remind us, the air we breathe, the water you drink, the food you eat, where you eat and work and play, have much more to do with your health conditions than the individual interaction with a healthcare provider. So those situations hit hardest on folks who are in an impoverished area, who don't have access to a work condition that is healthy, don't have places to play that are healthy. And I would say finally, so many of our brothers and sisters in the minority populations are in service jobs and essential jobs that they haven't had the luxury of actually staying home and being able to work. So they're more exposed. They're home health aides. They are janitors in buildings cleaning up. They're picking up trash. They are doing jobs that are relied on by the communities to continue on, but they don't have the luxury of staying home.
Well, it's interesting because you talk about, you're right, a lot of minorities, a lot of undocumented immigrants, they work in the hotel industry, they're working at restaurants, and what's interesting is we knew that they didn't have much of a safety net going into the virus pandemic, but yet the pandemic has laid it bare for all of us. And I feel like one of the themes we've been tackling with here at Bloomberg is fear versus greed. I mean, one of the questions coming in from our viewers, how do you weigh moral considerations against economic, that we're not paying living wages to these individuals so that they can have a safety net, so that they can pay for health care. We're constantly, it feels like, weighing that against making a profit. How do we weigh those two sides and get to a better place?
Well, I think the notion always put forward too often from the business community is we can't afford X. We can't afford everyone to have health insurance. We can't afford paid leave for our workers. We can't afford a minimum wage for our workers. That's nonsense. What we can't afford is what we're going through right now. Which is going to cost trillions and trillions of dollars and maybe take an entire generation to recover from. The economic hit of today of trying to react to these huge gaps in our social service system, in our safety network, in our health system is what we can't afford. So I was listening to the mayors in the previous conversation. I think the hopeful note is we've got to fill those gaps. We've got to come out of this not just reacting to what the world used to look like, but planning for a much different world going forward.
But how do we do that? And I guess when I kicked off our conversation is that everybody was so shocked by the headlines about these gaps that are out there. They have been out there for decades at this point, right? And we've had, lots of people talk about them. We've had administrations try to tackle them, but yet here we still are. And the most vulnerable are getting hurt once again.
Well, I think that's absolutely right. What is happening, though, is at least there's a bright light. Oftentimes there's a conversation about sort of us and those people. And while it's interesting and kind of a theory to talk about those people, too many folks don't interact, don't think about it on a daily basis. This is really bringing those people up close and personal, and it's all of us. And one of the things about a disease that's the great equalizer, a virus, the great equalizer is if you're not healthy and have the chance of making me not healthy, then I have a greater interest in it, right? If I'm an employer and suddenly have a workforce where if people don't have paid leave and they will not get tested because they can't afford to be off work, that could jeopardize my whole business. If suddenly I'm asked to, if we reopen and go into a restaurant, I want to know what the restaurant's policy is on sick leave for their employees. Has everyone been tested? Has everyone been treated? Do they have a guaranteed job on the way back? Because that will give me assurance that it is a safe place for me to be. So we are suddenly really connected to one another in a way that we hadn't been in the past. And I think it gives a real urgency to, you're going to send your kids back to school if you don't know that all the teachers there are healthy and ready to go, that the aides have been tested and are able to be treated, that the people who are serving lunch in the cafeteria are actually part of this big network. I mean, those situations suddenly are very important personally.
It's interesting because we do that with, hard goods, manufactured clothes, right? We have our younger generation, myself, looking at where's it made, are they providing a living wage? Are they good to the environment? Something you did big time while you were secretary at the Obama administration is the Affordable Care Act. And we've got a poll and maybe we can bring it up for everybody's out there because almost 28 million people are still uninsured in the U.S., and we may see that get worse because of the unemployment spike. So the question I have for everybody in the poll is how can the federal government ensure the uninsured receive adequate health care? And the options are to answer reopen enrollment on healthcare.gov with options available for those who lost employer coverage. Another answer, pay for the full cost of coronavirus-related health expenses. Patients pay zero. Provide direct financial aid to those in the lowest income brackets, and leave it up to state and local governments. So while people answer that poll, Secretary Sebelius, what's your answer? How can the federal government ensure that the uninsured receive adequate care?
Well, I think short term, we've got to do sort of all of the above. Opening up the marketplace so people who lose their employer-based insurance qualify for subsidies and can get insurance quickly. Put pressure on states. I live in a state, horrifyingly, where the legislature got themselves safely out of town and left the Medicaid expansion bill on the docket. There are enough votes there, but the president of the Senate has used a variety of procedural issues. We've got 200,000 Kansans who are eligible for health benefits in the midst of a pandemic, and yet they're playing politics with people's lives. That's horrifying, and that's going on in 14 states around the country. I read recently, Carol, that community health centers, which are often the safety nets for people who don't have insurance, who may not be documented, who are not eligible for benefits, community health centers are looking at layoffs because of the restriction now in primary care. That's terrifying. So pushing money quickly into those centers, making sure that they are available. But we have to do this long term. You know, testing for free was part of the bill. What about treatment? Who's going to get tested? I can't tell you before the Affordable Care Act how many women would say to me, I know I can get a mammogram for free, but I won't go get a mammogram because I have no way to pay for the treatment if I have cancer. So all that will do is add worries to me. We've got the same situation with lots of folks. Why should they get treated? If they're positive, they're not going to be able to get why should they get tested if they can't get treated? If they go into financial ruin because of ending up in a hospital, that can't happen in the future. So we got to have a short term, get everybody healthy quickly, but also we need an administration committed to universal health care. We need a Congress who says we're not going to try to take people's health care away. We're going to try to make sure that we have everybody in the United States with access to regular preventive health care.
I have to ask you, how do you think the federal government has done so far in handling the virus? And I know you spoke to the Associated Press, I guess a few weeks ago or in the last month, and you said we basically wasted 2 months. I mean, timing, we know, has been so important in dealing with this virus and getting ahead of it.
Well, I think, unfortunately, we still are in a situation in mid-April having the same conversation we were having at the beginning of February. We need massive infusions of tests everywhere. I don't want people just to be tested on the way into the hospital. That's important. But what's really important is to know who's asymptomatic and roaming around. We need massive community testing. And, you know, you heard Mayor Durkan in Seattle, yes, we had outbreaks in the nursing homes, and yes, they were on top of that. What about the testing throughout the Seattle community? How many people actually have the virus who never show symptoms? What does that look like? What are the patterns? So way behind on testing still. We are getting now all kinds of mixed messages. You know, for a long time we were told, don't worry about this, we got it under control. Then we were told it's very serious. Now we're in a situation, I was saying to somebody the other day, I have the feeling I'm in the car again with my children when they were very small, saying, are we there yet, Mommy? Are we there? No, we just left the driveway. Are we there yet now? Are we almost there? No, we're not there yet. We need a message about how we get from where we are now, mid-April of 2020, to a major vaccination campaign throughout the country. That's a long stretch. That's a marathon. It's not a sprint. It's not going to be over next week or next month. It's going to be multiple phases. We need somebody who's communicating that out of the White House. We need the scientists to tell us what the plan is.
I wanted to ask you, as a former governor and then also as a former member of an administration, as you see the battle between the federal government and the governors, I'm just curious, you know, kind of where do your sympathy lies, and what do you make of the governors banding together, which people have thought, I will say, I feel like there's a consensus that that's been our leadership model. And thank God for that.
Well, I've never seen anything like this in my life. The entire time I was the governor, George W. Bush was the president. So I'm a Democrat and he's a Republican. That didn't matter in times of crisis. We had a number of natural disasters. We had a number of, we had a huge economic downturn. We were all in this together. We had we might have had debates between the governors and the federal government always on how far you go, how many rules there are, is there enough money? But there was never a sense that we were being pitted against one another, or that red state governors were treated differently than blue state governors, or that you were criticized for asking for resources, help, and support that was uniquely at the federal level. I've never seen a situation like this in my life. It has to be terrifying to be a governor, to know that if you ask for what you need in your state for your citizens, that you're somehow regarded as unappreciative, that you're being told your calls might not be returned. That's a terrible message. And governors are wise to band together and say, we're going to, be the sort of grown up in the room. We're going to lay out rules, and the rules have to be regional. They can't be border at a time. And we're going to try to make our plan for how we deal with the next year.
So how do you see the next year? And it's interesting. There's a question that's come in. How can the pharma industry contribute to better access to healthcare in a crisis? And it's interesting to see, I feel like, whether it's Silicon Valley or the pharmaceutical, communities, often competitors now working together, right, for a common good. You are very familiar with a lot of the pharmaceutical companies. So what are your thoughts on that?
Well, I think a couple of things. One is there's a great scramble underway, scramble in a good way, that people are feverishly working on what could be very positive treatments for this disease. So we really can lower the death rate. Even if we have spikes again, we can figure out treatments that really work. That's a huge, important role of the pharma industry, and concentrating on that and moving ahead on that is hugely important. I think the vaccine, again, there are tests and trials and things underway. We may get lucky in that the first one or two have a real hit. It may take longer. I think it's really important for pharma to, again, speak with a voice and remind people that we have treatments now for diseases that were considered to be a death sentence. We have vaccines for diseases which people thought could never be eradicated. That this is really the promise and possibility of science, and that we're collaborating. And I found it terrifying to have the President of the United States suggest that he would withdraw funding from the World Health Organization. This is a global crisis. We are fortunate to be one of the richest countries on the face of the earth, but my God, this is going to hit in developing countries, and a disease in a developing country will have a much wider swath, but it also makes Americans less safe and secure. As long as this virus is circulating, it can come right back home. So participating in a global solution, participating in a global effort to share information, eventually share treatments and vaccines is hugely important. This is the worst time in the world to withdraw from the global community.
Just got about 30 seconds left here. Do you think we've done what we need to do for a reopening of society?
No, we absolutely have to test. We have to have a way of surveilling people as they come back, and an effective tracking system. And I think we need to make progress toward treatment so that we know if it spikes again, that we actually can treat some of the more seriously ill and not look at, again, a spiraling death rate.
Secretary Sebelius, thank you so much. We really appreciate your insight. Have a great day, and thanks again. We really appreciate it. Jason, another great conversation. I'm going to hand it over to you because I know you've got someone standing by.
I do indeed, Carol. And Secretary Sebelius, Governor Sebelius, just teed us up so nicely for our next conversation, alluding to this global nature for sure. So let's bring in now David Miliband, President and CEO of the International Rescue Committee, of course, former Secretary of State for Foreign Affairs of the United Kingdom. He joins me from Connecticut. David, nice to see you.
Nice to see you, Jason. Glad you're well.
Thank you, and I trust you're well and your family too. I know you are thinking about this, obviously, given your job on quite the global scale. What's the thing we are missing about this pandemic beyond our borders here in the United States?
I think we're missing the real threat to life and livelihood for literally tens of millions of people who have no prospect of the kind of health facilities that exist in the United States, but also for whom the idea of quote unquote social distancing just isn't possible. Obviously, the population density in New York is severe, 10,000 people per square kilometer. We know that refugees, 1 million refugees in Cox's Bazar in Bangladesh from Myanmar, their density is about 40 to 70,000 people per square kilometer. We know that in northwest Syria, a war zone that's been in the news certainly last month, the population densities are also several times the New York levels. And so organizations like the International Rescue Committee, which works in 200 war zones and refugee hosting states around the world, we are battling to do some very basic prevention, because we know that once the disease becomes seeded, it will run rampage in very vulnerable communities.
And what are you seeing? Your folks are on the ground all across the world, and one of the most interesting and candidly frightening when you look at the data, it sounds like, is Africa, where we have not seen, and keep me honest here, a huge number of cases, but that feels like haven't seen them yet. What do we expect there?
You're absolutely right. There's less than 10,000 recorded cases in Africa so far, but obviously there are many more than that. Having said that, we operate in 18 African countries, and we haven't yet seen the rampage, the surge that might be expected. That's partly, I think, explained by the youth of the population. It's a more youthful population, and we know from advanced industrialized countries like the US that the young people are better protected from this. But I fear that it's a matter of time. And that's why our emphasis is so much on the hand washing, the basic hand washing facilities that are possible, the fever testing that is possible, the even basic isolation centers for people who do have a fever and might have COVID. We're not going to be able to rush masses of ventilators into South Sudan. There are 4 ventilators in the whole of South Sudan for a population of 10.5, 11 million people. But we have no excuse for not doing the basics to try and prevent the spread of the disease. And also, frankly, to take on one of the biggest scourges, which is fake news. We have to use our role as trusted intermediaries, because we hire local people to get the facts across, because a lack of information is a massive issue in the places where we work.
So I want to put up a poll question that's going to lead us into the next part of our discussion, very much on the news, and it's about the WHO. Let's pull that up if we can. I'm just playing with my screen here. Obviously, the big news was the President of the United States halting funding for the World Health Organization, and it's a pretty simple question. Do you think the U.S. should halt funding for the World Health Organization? It's the right thing. For various reasons, you're seeing that it's the right thing. The WHO failed. It's the right thing. America should focus on its own funds. The WHO may have failed the world, but a halt on funds endangers the U.S. It's the wrong move. I have a feeling I know where people are going to end up on this. From your perspective, David, both in your current job and also as a former government official, what's your read on this decision? How, or what is the net effect of both the actual pulling of funding, but also the message that it may send?
Well, I think you're right to see this in 2 dimensions. First of all, what's the health impact? And secondly, what's the political impact? Look, US money goes to fund, 27% of the US money goes to fund polio eradication. 17% of the money goes to fund vaccines and nutrition work. So the danger of this decision, if the review leads to a genuine cut in funding, is that it's a death sentence for some of the most vulnerable people in the world. The people who will pay the price are not those who the administration holds responsible for the failings in respect of COVID. It will be very poor people in very poor parts of the world, because American money is a lifesaver. The second aspect of this, obviously, is about international leadership. And there is a real danger that the lesson of this crisis is that America and the Western world can't cope, and that America and the Western world is giving up its leadership role. And you know that China is on a major public relations offensive in respect of this. It's viewing the vacuum in international politics, and it is seeing opportunity. And so I think there is geopolitics in this decision, as well as a real health danger. And I hope that your poll results, it looks like they do,
yes.
People have seen sense, because there is real short-sightedness if this review leads to the kind of cuts that are being heralded.
Right. Yeah. No. Overwhelmingly, people saying wrong decision. So we'll see whether the government is listening to our audience and others. Certainly, I mean, you've seen a fairly swift and I think it's fair to say bipartisan reaction against that potential pulling of funding. I have to ask you, speaking of geopolitics, having served at a high level of government, dealing with governments all around the world, David, I wonder what you make of Europe's response specifically, because it feels like there has been a divergence depending on where you look. What have we learned and what can the rest of the world learn, especially when it comes to the more vulnerable populations, about what works and what doesn't in fighting this virus?
Well, I think there are three very striking things, in fact. One, you've mentioned, a diversity of response from different European countries. Secondly, the strength of the European safety net, stronger than in the US, fewer holes than in the US, leads organizations like JP Morgan in their economic impact assessment to say that European countries will suffer less than the US, which I think is very striking. The third thing is that the European Union has historically had very little role in public health. And so the pan-European response has been weak. The European Union has been playing catch-up. But you're seeing in the agenda for the virtual summit, which I think is happening today and tomorrow in the European Union, among the 27 European leaders, that they're trying to play that catch-up game fast. Now, obviously, it's very striking that Germany has come through this very strongly. They did not go in for the denialism that seems to have been present in the US, the UK. They didn't stick their heads in the sand. They took early measures. They get their testing up to 50,000 people a day very early on, 350,000 a week. And it looks like Germany is both containing the number of cases and containing the number of deaths. And I think that gives lie to the idea that it's only the autocratic countries that are doing well out of this crisis. It's not true. Some democracies are doing badly, but some are doing well too. And I think it's very important that we now get the ballast of a European Union-wide economic and social response, because countries like Italy really need the help.
And so, and this is a question in several variations that's coming through in our audience Q&A, which is essentially, as we think about this across the rest of the world, as you're talking to heads of state, as you're talking to various leaders around the world, how much do you worry about the role of NGOs or the diversion of funds that might normally go to refugee crises or other work that you're so involved in? How much do you worry about the world sort of getting distracted by this crisis and maybe ignoring other crises, even knowing and conceding every crisis, it feels like, is somehow interlaced at this moment?
Well, I think there's a very important point that you're raising there. The old problems don't go away because we've got this massive new problem. In fact, the old problems in some ways, the lack of universal health coverage, the weakness of the global anti-poverty regime, the tragedy of the trauma of acute malnutrition among 50 million under fives around the world, those problems are in danger of being augmented, of being grown, of being expanded by the COVID crisis, both because COVID is a force multiplier when it comes to poverty, but also because the world turns inwards, or if the world turns inwards. And I think there's a real contest. I've actually written about this in a UK magazine, The New Statesman, which people can read today, about 4 contests that are going to define the post-COVID world. One of them is about internationalism versus nationalism. One of them is about equality and inequality. But it's also absolutely central that the world has to address the contest over how it fixes its global responsibilities. Because to my mind, COVID is a disease of the global community. It's a disease of the connected world. And it requires us to think, yes, about the acute local problems that exist in New York or anywhere else in the United States, but also are global. And we're not going to return to normality until those global problems are addressed, as well as the local problems.
So from an optimistic standpoint, and I brought this up with the mayor of Chicago earlier, and Rahm Emanuel, a person I know when he was President Obama's chief of staff, said never waste a good crisis. That sometimes there is an opportunity to reset, and I appreciate, I think, knowing you a little bit, knowing your work well. And it was funny when I was preparing for this, I recalled seeing a great 60 Minutes piece about the work that you're doing with Sesame Workshop, with refugee children. And I do wonder, in this age where we are thinking more about our humanity, is there an opportunity? I'm trying to give us some hope here at the end, that maybe we are resetting as humans, and maybe we are thinking about the more vulnerable among our populations, because this has brought to bear things that we know were out there, but maybe it wasn't so much in our face for a long time.
Well, look, I think it's a contest, and here history can be our guide. I mean, the contest is between the reaction that we saw after the First World War and the reaction that we saw after the Second World War. After the First World War, we tragically failed to learn the lessons, and we laid the foundations for what became the Second World War. Nations turned inward. There was a failure of the League of Nations, which after all was vetoed in the US Senate, and the international order collapsed. After the Second World War, the lessons of the interwar period were learned, and global institutions were established. Global rights for individuals as well as states were set out in international law, and there was the foundations laid for the most sustained period of peace and prosperity the world has ever known. Now, I don't hide at all the traumas of the Cold War. It would be madness to forget all of the problems that existed in the post-Second World War period. But it marked a period of lesson learning of a really profound kind. And if you want an optimistic view of the future, you've got to say that this crisis needs to lead to the kind of lesson learning that happened after the Second World War, not that which happened after the First World War. And I think the lessons are stark. They start with the origins of the crisis, about how countries cover up information, but they also then go to holes in the global safety net, never mind the national safety net, that have exacerbated the damage of the disease and will prolong the extent of its economic and social consequences. And so that's the optimistic way of thinking about this, that human beings should be rational and that we've got work to do.
So last question for you, David, before I let you get on to the very important work that you're doing. And I know that this is something you face all the time, and I think you and I have talked about it before. A lot of refugee crises seem so far away to us. And obviously, even in the midst of all of this, we are very self-focused, and that's who we are as human beings. When you think about the rest of the world, and we are reminded how interconnected we are, what's your best advice for how we don't lose sight of the rest of the world? What can we do to make sure that that stays top of mind?
Well, in the United States, to a US audience, there's a pretty simple answer to that. You just look around you. We've launched a website for the 160,000 refugees and immigrants who have medical qualifications from other countries, but aren't yet working in the United States. It's called refugees.rescue.org. Look around you, Americans. There are people here who are refugees, who are immigrants, who have that background in their family, and they're ready to be mobilized for this fight for America's benefit. And America's strength has historically come from the fact that it's been open to the world, not closed to the world. And so I think that the local issues that we face here, I'm speaking to you from Connecticut, they're all across the US. Life is a team sport, and we're going to have to pull together. But there's also a global team here, and that's the message, I think, of this crisis.
All right. Well, we're going to leave it there. David Miliband, thank you so much. Really good to spend some time with you, albeit virtually. Hope to do it again in person before too long, when the world at least figures out what this new normal looks like. David Miliband, of course, President and CEO of the International Rescue Committee, joining me from Connecticut. Well, that's going to do it. Thank you so much, everyone, for joining us. Our first Bloomberg Equality virtual briefing. We did it. We pulled it off. My thanks to Carol Masser, my partner in crime. You can tune in to us later on this afternoon, in about an hour, we'll be live on the radio. I'll be sitting right here with a different setup. You'll just have to hear the sultry sounds of my voice, as well as Carol Masters there in Jersey City. We hope you enjoyed these discussions. You'll get an exit survey as soon as we wrap up. Thanks so much to our speakers, Kathleen Sebelius, Lori Lightfoot, and so many other interesting conversations that we had, with David Miliband and with Jenny Durkan as well. Also want to thank LGBTQ Loyalty for supporting today's event. Couldn't have done it without them. And thank you for being so engaged. Great questions. And thank you for responding to our polling. We're going to keep covering this story. Obviously, it is the story of our time. I think it is fair to say Bloomberg has got you covered, not just on the radio, not just virtually, not just on television, but I would point you to just some spectacular coverage that our team is doing across the world. You can go to bloomberg.com/coronavirus. You'll get all of the latest stories. Obviously, this is an economic, political, markets, and very much a human story. Thank you so much again for joining us. Signing off from Sleepy Hollow, I'm Jason Kelly.